really wonderful to be here. I'm really happy to be here. And I hope you find this as interesting as I did while I was doing it, but at least most of the time. So let's get started. So the work is on dams and infant mortality in Africa. So what was the motivation for the research? Well, dams have played a very important role in economic development. So they're responsible currently for about 30 to 40% of the world's irrigated area and about 19% of the world's electricity generation. But, as we all know, dams have very negative effects on the surrounding environment. For example, flooding, alteration of river flow, and impacts on the soil such as increased salinity. So all these things have negative impacts on agricultural productivity and therefore also on households that depend on the land for their livelihoods. But despite these very large and conflicting impacts, the literature on the welfare effects of dams is surprisingly small. So there's very little work in this area. Specifically for my research, how dam effects impacts infant survival is a question that's yet to be investigated. Now, bringing it to the African context, currently there's a surge in dam construction taking place across the continent. Some of the largest dams in the world are being built in Africa. So, for example, Gibe 3 in Ethiopia, which is designed to provide electricity to 3 whole countries once it's completed. Also the Grandinga in the Congo, which is probably going to be the second largest dam in the world once it's completed. So how dams actually affect infant mortality on the African continent in the current policy climate is a very important question. And this is the question I'm going to try and address in my research. So looking at the related literature, the most famous paper in this area is by Esther Duflo and Rohini Pandey. It came out in the QJE in 2007. And they look at the impact of dams on agricultural productivity and poverty in India. Their first main result is that they find that a nearby upstream dam is beneficial to agricultural productivity in the region. It reduces poverty as well, and it does this mainly by reducing vulnerability to rainfall shocks by providing irrigation. And it also regulates the flow of the river through controlled discharges. Their second main result is that poverty and vulnerability in the actual vicinity of the dam, so not immediately downstream, but just around it, actually increases in the districts where the dam is constructed. So you have these two spatial effects. Then this research was taken forward by Strobel and Strobel in 2010, who analyzed a similar question in Africa. They find also that a nearby upstream dam is good for agricultural productivity in a downstream basin. They also find that in the actual vicinity of the dam, so the same river basin, agricultural productivity actually declines. And they estimate that the decline in cropland productivity in Africa over that approximately 20-year period from 81 to 2000 was about 1%. So where does my work fit into this literature and what contributions am I making? So first of all, I'm going to estimate the impact of dams on infant mortality, where infant mortality is a completely new outcome variable. It's not something that people have thought about in the literature thus far. So in that sense, it's a new contribution to the welfare literature. Secondly, I'm going to separate the impacts of upstream dams, depending on whether they're close by, which is the only kind of upstream dam people have thought about so far, from upstream dams that are very, very far away up the river. Now, this is something that's important in the African context for reasons that I'm going to get into immediately after this, but it's also a new contribution in terms of the spatial effects of dams on households. Let's go back. And finally, the estimations are at the child level. So previous papers provide impacts of dams at regional aggregates of poverty or productivity. So I'm going to actually present child-level estimates of what happens to survival and mortality probability. And I'm going to use a sample of over 400,000 kids taken from 17 African countries. So it's a very comprehensive cross-continental survey. So how do dams actually affect households who are exposed to them? A dam is built essentially by building a wall across a river and obstructing the river. So what that does is, since the river is blocked from flowing past it, unless the wall is allowed to open through sluice gates, the river gets blocked up and it creates a very large reservoir immediately upstream from that wall. And then water from the reservoir is used to provide irrigation immediately downstream through gravity-powered canals, or river gradient steep gravity is used to power turbines to provide electricity. Now, obviously, when a dam is built in this way, it has different spatial impacts along the river, depending on where households reside and the flow of the river. But I'm going to focus on 3 areas, which comes from the literature that we've been talking about so far. And the first area I'm going to look at is the area in the actual vicinity of the dam and in the vicinity of the dam reservoir. So in the area in the vicinity of the dam, or around the reservoir, you have what's known as the catchment area. And the catchment area is the land around the reservoir that actually absorbs water from it. And what happens to this land, typically, according to the previous literature, is that it gets subject to waterlogging and increased land salinity, both of which greatly reduce agricultural productivity and potentially reduce agricultural incomes in the area. So through reduced agricultural income, you potentially have lower child health investments, which can manifest in higher malnutrition, more disease, and therefore higher infant mortality. Now, besides the income channel, there's a direct channel, a direct impact on health, which is through increased waterborne disease. Around the reservoir, obviously, people are potentially exposed to higher incidence of malaria, river blindness, and schistosomiasis, as well as other diseases. This is something that the medical literature has looked at, and they found that around dam reservoirs, these diseases tend to show up with higher incidence. Now, those are both negative impacts, but there are positive impacts as well. So around the dam reservoir and around the dam site in particular, you usually have increased economic activity. So because a lot of workers usually come into the area to try and build the dam, you have other people coming in to form these kind of temporary settlements around the dam to provide business and other services to those workers. And these settlements can potentially be quite long-lasting, even after the dam's been completed. So through these potentially long-lasting social networks and business opportunities, you can actually have higher income generation in the region as a result of the dam showing up. So a priori, we can't really say which effect is going to dominate, and we actually have to go to the estimation results to see which effect actually is more important.
Is it also common for in these areas for households that are displaced by the dams to be compensated significantly by the?
It depends from country to country. You know, for my particular analysis, because I'm only looking at the spatial effects of dams, I'm actually not going to be talking about migrants at all, because I don't know how it's where they come from, where they go, and why they come and why they go in my data.
Okay.
So I'm only going to try and identify the spatial effects of the dams using non-migrants, which is something I'll get to in a minute.
Okay.
So the second area I'm going to be considering is the area that's immediately downstream from the dam. So in this area, you have what's called the command area, which is a designated area for dam irrigation. So the dam provides irrigation in this area that's immediately downstream. Now, the irrigation network provides a constant source of water for agriculture, which potentially then increases agricultural productivity. It also reduces the volatility of people's incomes because they're less dependent on rainfall for agricultural production. And therefore, you potentially have reduced infant mortality through higher and more stable incomes. There's also, again, increased economic activity around the dam site that's immediately upriver, if it's close by, and people can benefit from that as well. Now, we get to the point that's really important in the African context, which is what happens downstream from the dam. Now, the dam, because it blocks off the river, essentially reduces the height of the river as it keeps flowing past the dam. Now, the reduced height of the river is very, very harmful for the type of agriculture which is called floodplain recession agriculture. Now in Africa, this form of agriculture is very important. So what it is basically is that the river floods once or twice every year seasonally, and it leaves behind fertile silts. And then households wait for the river to recede back to its original position, and then they cultivate those fertile silts. Now if a dam suddenly shows up and reduces the height of the river, it sometimes prevents rivers from flooding at all. Now this is something that's important in all downstream regions. The best example is the Nile in Egypt, which used to flood very famously once or twice every year until actually the Aswan Dam was built on it in the early part of the 20th century. And then that river actually stopped flooding. So this is potentially harmful for households, even if the command area is in the same region, because if they have to, for example, switch to a different form of agriculture, or if the command area is just too far away for them to access irrigation, this negative effect will potentially outweigh the positive effects that the dam is supposed to provide. Now the third area which I want to think about is even farther downstream. So if you go farther even beyond the command area, as I mentioned, households won't be able to access the irrigation network that the dam provides, and they're still exposed to the reduced river height. And this is potentially, again, detrimental for them if they practice floodplain recession agriculture. Another example there, which I put up, is that the Balakori Dam in Nigeria, according to one study, reduced flood levels by about 50% downstream. And about, again, 50% of households who live downstream had to abandon dry season agriculture as a way of life because of that. Now again, there's a potentially beneficial impact, which is that in bad rainfall years, the dam can be used to release water in a controlled fashion downriver and provide counterbalancing water supply when rainfall is poor. So again, in this region, you can't really say what's going to happen with certainty as with the other two regions. So just to talk about this a little bit diagrammatically, if you think about Dam A as a hypothetical dam on a river flowing east to west, this circular region here represents the catchment area, which absorbs water from the reservoir with all the negative effects that I've been discussing. If you think about the rectangular area as the downstream region where you get irrigation from the dam. And then beyond the command area, you have a lower water level with the potential harmful effects. Now, I have data on almost 1,000 dams on the African continent, and I can pinpoint them very accurately. I also have very accurate data on where households are in my survey using GPS locations. But unfortunately, I don't have accurate data on the extents of the catchment and the command areas. So what I'm going to do is I'm actually going to use river basins. So just to see how that's going to work. If you divide out the map into quadrants, you think of the first quadrant as a river basin where the dam is actually constructed, where the yellow circles all represent households in my survey. This is going to be area 1, so the area in the vicinity of the dam, with households potentially benefiting or suffering depending on whether they're located in the command area or the catchment area, for example. Area 2 is going to be the neighboring downstream region, or in this river basin here, where households again benefit or suffer depending on where they are relatively outside or inside the command area. And then river basin 3 is going to be area 3, which is people who are very far downstream and can't access the irrigation network and potentially benefit or suffer based on which effect dominates for them. And households in quadrant 4 or quadrants like that are going to represent my control households.
So how do you determine how those get cut up?
I'm going to use GIS data from the US Geological Survey, which actually divides up the African continent into these river basins. So that's something I'm going to talk about just a couple of slides. So what data am I using? The data on the dams in Africa comes from a georeference database on African dams. It was created by the ACOSAT program in the FAO in 2006. It provides me with the exact dam location and year of construction or start of operations of the dam for about 1,000 dams on the African continent, so it's very comprehensive. And what's great is that it has a lot of variation, or there is a lot of variation in the level of dam construction across the continent for me to exploit empirically. And there's also a lot of variation in the years in which dams show up, which is something I'm going to be exploiting. So the oldest dam was built in 1691, and the newest dams in the data set are actually still being constructed and are not completed yet. The data on the households and children comes from 32 waves of the demographic and health surveys across 17 African countries. So the demographic and health survey is a survey that is based on interviews of women aged 15 to 49, and it collects very, very detailed data on their fertility history, the mortality history of all their kids, when their kids died, and the sample size is actually very large. If you put all these surveys together, it's about 1 million kids almost. And what's great is that, as I mentioned, it has GPS data accurate to within a 10-kilometer radius of where these households are actually located. So I can pinpoint them as well as the dams on the African continent.
So you have GPS data from all 32 waves, or?
All 32 waves. And again, there's a lot of variation in child location and the years in which the children are born. So there's children born in 1960 all the way up to 2008, all across the continent, and born across several different countries. So that's again something I'm going to exploit when I get to the estimations. Now, briefly about the river basins. So I know where households and dams are on the continent, but I still don't know how they're linked in terms of are they upstream or downstream from each other, where are they on the river network. So this is where the river basin data comes in. So the data on the river basins is from a data set released by the US Geological Survey. It breaks up the entire African continent into more than 7,000 river basins, each of which is about 65 kilometers by 65 kilometers in area. And what's great about this data is that each basin has a 6-digit code that tells me how it's connected to all the other river basins on the continent. So if I know which river basin a household is in and which river basin the dam is in, it's very easy for me to say whether a household is upstream or in the same river basin as a dam based on these codes, and that's exactly what I do. So it allows me to link up all the households to all the dams and to do my analysis. And just another word on the river basin. So it's defined at 6 different levels. So the smallest river basin is the level 6 basin, which is 4,200 kilometers squared. And this is the level at which I do my analysis. But then these are nested within level 5 basins, which are even bigger, right, contain about 1 to 2 up to 10 level 6 river basins, and all the way up to level 1. So I'm actually going to use the change in size and in levels of river basins for my robustness checks again in the future as I keep going. Now, what are the major issues that my econometric strategy is going to face? The first is that obviously households are going to endogenously move around once dams start to be built. So how do I get around this problem? I'm going to isolate about 100,000 non-migrant mothers who never moved over the course of their lives, and I'm only going to analyze the kids born to these women. So how does that help? It helps because non-migrants are there in the same place both before and after dams are built and never moved. Okay. So therefore, both children who are exposed to dams, who were born after the dam shows up, and kids who are born before the dam shows up, who are not exposed, are born into the same households, because these households never move. So this makes them more comparable. Whereas with migrants, you have a problem that after a dam shows up, if a whole new set of people show up, then kids born to those mothers are different from kids born to the mothers who were there before, and you can't really compare them. Now, obviously, there's going to be reasons that influence why non-migrants remain, and that could be correlated with various types of dam coverage and bias results. So there is some kind of selection problem here as well. So the way I'm going to address that is I'm going to show you a lot of additional regressions, a lot of robustness checks. I'm actually going to show you an instrumental variable regression as well, which potentially deals with all these concerns. And I'm going to show you that the results hold up across all these estimations. So the second problem is that dams that are exposed, basins that are exposed to dams, are not the same as basins that are not exposed to dams. Okay. So the first reason is geography. Dams need a moderate to steep river gradient to operate, because gravity is what powers water forward and what provides irrigation, and also what powers turbines for electricity. Secondly, dams could be endogenously targeted to areas with high or low mortality. Okay, so a government may decide to build a dam in an area with low economic growth because they want to stimulate growth in the region or something like that. Now, obviously, this could bias the results as well because of omitted variable bias or unobserved processes that I don't observe. So to deal with this, I'm going to use the variation in location and timing of dam construction and childbirth to do a difference in difference estimation. So I'm going to exploit the variation in the number of dams that come up over time across the basins in the continent, as well as within each river basin, I have a lot of variation in when kids are born. So I'm going to estimate within each basin the impact of the number of dams a child is exposed to at the time of his birth on the probability of the child's death aged between 0 to 12 months, so just in his first year of life. The number of dams he's exposed to in the year that he's born, and just look at how that number of dams impacts his survival probability. And there's 3 types of exposure I'm going to talk about based on the 3 areas that I discussed before. The first is dams within each river basin that a child is exposed to, then dams in neighboring upstream basins, and then downstream dams that are farther away, so non-neighboring upstream dams. So just to look at how dams are located across the continent, the red squares represent dams. So those are all the dams in the data set. You can see there's a lot of regional variation, and there's a lot of variation over time and when these dams show up. And it also depicts the river basins. So each river basin is a unit of analysis where I look at where kids are born and how they're affected based on where dams are placed. If you look at this quick picture of how the infant mortality rate is evolving over time on the continent, about 130,000 kids from the entire sample of 900,000 die before the age of 5. And within that sample of kids who dies between the age of 5, 70% of them actually die in their first year of life. So this makes this outcome a very, very important outcome for us to actually analyze in this piece of research. But the infant mortality rate does seem to decline a lot in our sample. So kids born in the 60s have an infant mortality rate of more than 20%, and then it comes down to about 10% or slightly less in these years. And this is to look at how kids are falling into different levels of exposure over time. So almost 80,000 kids over time are exposed to a dam within the same basin, which is a very large fraction of the sample. But upstream dams, it's much less. You have about 3,000 kids over time, increasing over time, but still it comes to about 3,000 kids who are exposed to a farther upstream dam, and 5,500 exposed to a neighboring upstream dam. And again, if you look at the number of dams kids are exposed to within the same basin, again, the number is very high, a maximum of 67. But not so many kids at that level of exposure, though. And again, the maximum for neighboring upstream dams is 4, and for farther upstream dams is 6. So we come to the econometric specification. So my outcome of interest is just a binary 0-1 variable, whether a child dies age 0 to 12 months, where we're looking at child I born in any river basin J. So to introduce a specification line by line, that's the outcome variable on the left. And these are going to be my 3 regressors of interest. So the first regressor of interest is the number of within basin dams child I is exposed to in the year of his birth, where B denotes the number of dams that's already there by the time he's born in that category. Similarly, U dams underscore neighbor is the number of neighboring upstream dams in the neighboring upstream basin that the child is exposed to in the year of his birth. And that's going to be the total number of upstream dams, both neighboring and non-neighboring. So this is separately going to identify the effect of the neighboring dam from other kinds of upstream dams. And the effect is actually going to be beta 2 minus beta 3 when we look at the coefficients. Now this is going to be separately identified from the total number of dams in each category that the basin has ever been exposed to. So you put these into the specification to control for total levels of exposure fixed over time in the current period. And this is what's going to vary over time based on when kids are born in a particular basin. And finally, there's a vector of additional controls, including level household variables, basin level fixed effect, which are going to vary over level 5 and level 6, a year fixed effect, and an idiosyncratic error term. So again, just to highlight those variables, those are going to be my regressors of interest. And just to, again, refer to the diagram, the first regressor is going to refer to kids in area 1, born in the vicinity of the dam. The second one is going to be look at kids in area 2, immediately downstream. And finally, the final regressor looks at kids in area 3. Sorry, again, yours.
So can I ask you why you did the number of dams versus just yes or no?
I'm going to do yes or no as well. So, okay. So I'm going to break up the dam counts into categorical variables as well. Obviously, this specification assumes that every single dam has the same effect when it shows up. So I'm actually going to break up into dummy variables, yes or no, and then a dummy for each level of the dam exposure.
I guess what I meant to ask before was, if you look at your picture, how do you know where to place that vertical line to divide the areas that are?
It's just the basin boundaries. So I've made it into squares just for the picture to make it easy to understand. But each basin obviously is defined in terms of its area. So let's look at the first set of results. Now, when you put in the regressors from the first specification, yeah, sorry.
This might be a silly question, but the data that you use for dividing up the river basins, that's clearly created by the Equistat group. Does that accurately capture the impact of the dam for your context, in the sense that we are really thinking about not necessarily just about the way water flows, but also economic activity and
sure.
So is that the appropriate context to think of? Or?
What I'll be picking up essentially is that because these guys are potentially close to the dam,
right.
But the difference for these guys is they're actually along the river network.
Right.
Whereas these guys are not connected to this dam by the river.
Right.
So since they're in the control group, the difference I'm going to be identifying is through the river network. So that's essentially what I'm interested in. So if you look at the first set of results, for within basin dams, first of all, with the continuous measure of number of dams at birth, we find nothing significant. But if you look at neighboring upstream dams, or kids in area 2 with the command areas, you find that the dams are actually reducing infant mortality on an average of about 4 to 4.6% significant at the 5% level. And for upstream dams farther away, they're actually harmful, and they're increasing infant mortality by 2.2 to 2.36%. And actually, the impact of these dams is this coefficient minus that coefficient. So these effects are actually in the order of 6 to 7% if you just take the difference. That's quite a big number. Now, moving on to the yes or no results, which we just talked about, there's a dummy variable to whether a dam is present at birth in any of those categories. So it's just a slight modification to the specification. And suddenly, within basin dams become very important. So if you look at just if there's a dam in the same basin at the time a child is born, you find that it increases infant mortality by 2.4 to 2.57%, which, given how many kids are actually exposed to within basin dam and how many within basin dams there are, is quite a big number again. If you look at neighboring upstream dams and upstream dams farther away, the numbers get much bigger, and they're in the same direction as we talked about before, which is neighboring upstream dams are very beneficial, and upstream dams farther away are very harmful. And finally, if you just look at dummy variables for each number of dam that shows up and see how the effect is changing, whether it's monotonic or non-monotonic, if you look at within basin dams, it goes up to 41, which I'm not going to go up to because obviously there's no room on the table. But every single coefficient is positive and significant, showing that within basin dams are actually quite harmful. And if you look at the size of the coefficient, it goes up to past 10% as the number of dams keeps increasing. So it's very monotonic and very persistent. If you look at neighboring upstream dams, these again are very persistent and very large, increasing in the number of neighboring upstream dams. Upstream dams farther away, again, almost all significant, all very persistent, and all more than 10% as the number of dams goes up. Now, so the results seem fairly big, they seem fairly convincing, but obviously there's potential sources of bias. So the most problematic source of bias for us, potentially, is that results could be driven by unparalleled trends over time between basins in mortality rates. So why could this happen? This could happen because, as I mentioned earlier, dams could be endogenously targeted to basins with high or low economic growth. So if a dam is targeted to an area with low economic growth, infant mortality rates could just be systematically very high in that region, and we could be picking up reverse causality. Similarly, because we're looking at non-migrants across different areas, these non-migrants could be very different systematically in their own observables. That could be correlated differently across basins with dam construction, and that could also bias the results. So the first test I'm going to show you to deal with this source of bias is that if there is some kind of omitted variable that's driving both the number of dams a basin is exposed to, as well as infant mortality in that basin, then that omitted variable would be correlated not just with the dams there before a child is born, but it would be correlated with the dams that show up after a child is born, because it's correlated with the total number of dams. Now, what's great in this context to perform a test is that dams that show up a long time after a child is born are completely irrelevant for whether that child survives in his first year of life. Okay. So the kid's born in 1983. We're interested in whether he dies from 1983 to 1984. A dam shows up in 1990. We shouldn't expect that dam to have any impact on his survival probability. So we perform a very simple test. We just put in all the dams that show up after 5 years after a child is born, and we see if we find any significant coefficients. Because if we do, then that would tell us very clearly that there's something going on that's biasing the result. So let's have a look. So the first panel is just the continuous regressors of the dams built 5 years after a child is born. You find in both specifications that they don't matter at all. Similarly, if you look at the yes and no variables, again, you find that they don't matter at all. So this is very, very encouraging. Yeah.
Why did you pick the 5 years?
Usually it takes about 5 years for a dam to be completed on average.
Okay.
So it's a good time. It's a good time reference. So we find that these don't matter at all, which is very encouraging for the results. Now, you could still say that, look, maybe mortality trends were very different before the first dam showed up, and then they became parallel afterwards, and there's still potentially some bias that that test is not going to look for. So the best solution to look for any that source of endogeneity is instrumental variables. So that's the strategy that the most famous paper uses, Duflo and Pandey. So I'm going to use a very similar instrument to what they use. First is I'm going to look at the number of dams built in the level 4 basin, which is a much more macro basin. which is going to pick up and be correlated with the number of dams in each level 6 basin that's contained within that level 4 basin, but still be at a macro enough level so it's not correlated with what's going on at the smaller level 6 level. Okay. Now, how those level 4 dams get allocated to a level 6 basin is dependent on geography. Okay. So it's going to be dependent on the gradients of perennial rivers in those basins. So what I do is I interact the level 4 dams that each kid is exposed to at birth with river gradients in the basin where he's born. So you divide up the perennial river gradients in each basin into 4 categories, with a low gradient, 0 to 1.5 degrees, all the way up to very steep, up to more than 6 degrees gradient in each basin. And as I said before, you usually need a moderate to steep river gradient for a dam to be placed in any basin within that level 4 basin. This is going to be a fairly good predictor of how dams are placed in that basin, how kids are exposed to them. And the great thing about these instruments is that they're very unlikely to be correlated with reasons for people to migrate. And they're also very unlikely to be correlated with any processes to do with infant mortality exogenously, besides those that are going to be instrumented for. Okay, so it's plausibly exogenous, and it's also plausibly external. Okay. Yeah.
So there are no systematic differences between the people that choose to live close to steep rivers and not steep rivers?
If you look at the covariates, there's not much difference. And there's also a very good paper by Terrell Dinkelman at Princeton, who's also used river gradients and land gradients as an instrument in her paper, and she shows that for South Africa, people are not different across land gradients. So there's a lot of evidence showing that it's not a problem in that sense. So what happens in the IV? So I use an IV GMM using those instruments. I'm just going to throw on a third column there to look at what happens with the continuous regressors and what they're instrumented for. And you find that, remember we found nothing for the continuous within basin dams before. Suddenly after instrumenting, you find a very large 10% harmful impact, which lines up with all the estimates I showed before. So within basin dams are very harmful. It's highly significant at the 1% level. For upstream neighboring dams, because the number of these dams is small, unfortunately, it's significant only at the 12% level, but that often happens with IV. There's not much you can do about that besides try and correct for the error process. But if you look at the size of the coefficient, it is almost 8 times bigger. So it's minus 0.32 as opposed to minus 0.04. So again, you find evidence lining up with the fact that these dams are very beneficial. And finally, if you look at upstream dams far away, again, 10 times larger coefficient after instrumenting, highly significant at the 1% level. So again, there's a lot of evidence showing that what I've been talking about so far is actually happening. Okay. Obviously, instruments, like I said, have to be exogenous and they have to be externals of the process. Okay. So to look at, first of all, whether the instruments are very good predictors of the 3 covariates I'm instrumenting. If you look at the F-stats, they're very powerful. So for within basin dams, the instrument is predicting it with an F-stat strength of 83, and normally what you want is an F-stat of 10. Okay. And over here it's found 59. Here it's more than 1,000. So it's actually a very, very powerful instrument. And if you look at the Hansen J-stat, which is a test for whether it's exogenous, so is it correlated with the error term? This is just a test with the hypothesis that the error term and the instruments are correlated, and are not correlated. So beta equal to 0. And it's very easily accepted at a very high p-value level of 0.95. So this procedure, again, is very, very, in my mind, encouraging in terms of the results that I've been presenting so far. Now, we have baseline results looking at how dams affect infant mortality, but what are the mechanisms, which is what should be interesting us as economists. So the first mechanism I'm actually going to look at is malaria. Now, I've talked about in the vicinity of dams, there is evidence in the medical literature of malaria. So I'm going to test for this based on whether children are born in areas where the malaria season duration of transmission is very, very long compared to those areas where it's very, very short. So the risk of malaria is much lower. And this is also acting as an additional robustness check because the only dams that matter for malaria are the ones that are in the vicinity of children, because that's where the reservoir is. So I should find that upstream dams, neighboring and far away, are completely irrelevant for malaria, but only within vicinity dams are relevant. Okay. Now, if you look at how malaria is spread over the African continent, in terms of the length of the season of duration of transmission, this is data, geographic data from the Mapping Malaria project in Africa, who provide GIS maps based on their studies across the continent of what the length of the malaria season is. The regions in white have a very short transmission duration season of 0 to 3 months out of the year. Then there's intermediate zones of transmission from about 4 to 6 months. And finally, the darker regions have almost year-long prevalence of malaria. And if you look at the yellow circles that are the households in my sample, you have a lot of variation across regions in terms of how they're exposed to different levels of malaria transmission. So what I'm going to do is I'm going to compare households born in intermediate and high-intensity regions to households born in low-intensity regions. Kids born, that is, in low-intensity regions, by interacting the dam variables with whether a child is born in an intermediate zone or a high-risk zone. And we'll look at what happens to the coefficients. So these are, again, just the yes-no variables, whether a within basin dam is present, or an upstream neighboring dam is present, or an upstream dam farther away is present, interacted with the intermediate length of transmission, or the high-intensity length of transmission. So the category of comparison is the 0 to 3 months, which is the low intensity. So the reason why I've highlighted those two coefficients is that those are the within vicinity dams, which is what we should be worried about. If you look at the coefficients, for a kid born in an intermediate zone, and if there's a within vicinity dam present, compared to a kid born in a low intensity zone, you actually find an increase in infant mortality over and above what we've already found, of about 1.2%. Again, if you look at a kid born in a high intensity zone, the harmful impact of a within basin dam goes up to 3.3%. So obviously malaria is an important mechanism through which within basin dams are having a harmful impact. And again, what's great for the results is if you look at upstream neighboring dams or upstream dams farther away, they're absolutely irrelevant for malaria.
Yeah. So I agree that the transmission period is important, but did you also consider using the data in the DHS on malaria self-reports?
I think the data in the DHS basically asks things like, did your kid have a fever? I didn't choose to use that because all these self-reports are endogenous. So that's often a problem with self-reported measures of disease. So this is because also this was very convenient in that I had accurate GIS measures. I was able to spread over the households and look at it that way. But that is an option I could have used, but I just didn't. I chose not to.
Do those look similar if you use the instrumented strategy as well?
I haven't instrumented for these because they're dummies. So when you instrument for a dummy, the senator explodes and you don't find anything. So I just chose not to. Now I've talked again about agriculture and floodplain recession agriculture. So is that actually what's happening? So that's the next test I'm going to look at. So the first thing I'm going to do is I'm going to identify basins that are important for agriculture in the African continent. And the way I do that is I'm going to use satellite data to identify basins that have cropland present. So what this is going to tell me is that because you can actually observe cropland from a satellite picture, it's going to tell me that in these basins, agriculture is very widely present, and therefore these basins are important for agricultural production. Then the second thing I do is I identify likely floodplain regions. Okay. Again, I'm going to use satellite-based data. And I'm going to use data on river runoff levels from the Global Runoff Data Center. And this data set gives you GIS data on simulated levels of river water that flows across the surface of land every year. It's based on climate, it's based on geography, it's based on data from gauging stations that measures the speed of the river between different points across the continent, and collected from all the way from the 1930s and 40s all the way up to the 2000s at different points. Okay. So I'm going to examine the effects of dams in basins with cropland and with high river runoff. Because these are the basins where floodplain recession agriculture is very likely to be practiced, where there's regular annual flooding, and also where cropland is present. So again, I'm going to interact with the presence of dams indicators with whether the child is born in the basin with cropland, which is just a two-way interaction, and then also the three-way interaction of whether a child is born in a basin with cropland and with high runoff. And we'll look at what happens to the results. So again, looking at this picture, the green dots indicate cropland. So if you look at how cropland is distributed across the continent, you can clearly see the areas where agriculture is very, very widely practiced at a very high level. The pink and purple areas represent different levels of river runoff. So again, the white areas are areas of very low river runoff, going all the way up to more than 1,000 millimeters per year across the land surface, which is obviously in the central area. So what I'm going to do is I'm going to define an area with higher river runoff if it has runoff of more than 250 millimeters per year. I mean, I play around with that, but the result I'm going to present is 250 millimeters or more, to construct my dummy variables and to create my interaction terms. So what happens with these interaction terms? So if you look at the first column, I'm just interacting the presence of the dam in each category with whether the child is born in a basin with cropland. So in this, just a two-way interaction, I find that it's actually within basin dams that are having an even larger harmful impact on kids who are born in an area with cropland, which is again telling me that the reservoir is damaging or having a very bad impact on the lands where agriculture is important and is creating a problem for kids born in those areas. If you look at the second column with the three-way interactions and just focus on the second half, which is where the three-way interactions are, in areas with both cropland and with high river runoff, which are likely to be floodplain recession agriculture areas, the upstream dams farther away, comparing high runoff areas to low runoff areas, is a difference of 8%, okay, or 7.5%. It's a very harmful effect again. And this is again telling me that it's through the agricultural mechanism that the dams are having an impact. For upstream neighboring dams, remember, it's the difference between these two. So it's upstream neighboring dams are still having a beneficial effect, because the effect is -3.5. So it's actually these guys, it's the upstream dams farther away, that are having the harmful impact. And this is fairly robust for not just for 250 millimeters or more, but if you change it to 150, 300, the results don't change. And it's always the upstream dams far away that have a very harmful impact, which is added evidence for the mechanism.
This high runoff is its mean annual runoff. Is that what it is?
Sorry?
Is it average?
It's just a dummy variable for whether...
no, the runoff variable.
The runoff variable is average across the year, yeah. So let's summarize what I've talked about so far. Within basin dams, according to my results, are increasing infant mortality by at least 2.5% for kids and non-migrants. If you look at kids born in cropland areas, the effect goes up very significantly to 11.5%. Okay. This is picking up the damage that the dam is doing to the agricultural land and how people are being affected by that. It's consistent with the findings in the previous literature, which also found, if you remember, that in the vicinity of the dam, poverty and agricultural productivity actually get harmfully affected. The malaria mechanism within basin dams also increase infant mortality by about 1.2% in areas where transmission duration is intermediate, 4 to 6 months a year, and by more than 3% where the transmission duration is almost a whole year compared to areas where it's only 0 to 3 months. Because this is telling me that in areas where malaria is systematically high, within basin dams again are...
I could be wrong, but from the pictures you showed us, it looks like the malaria transmission areas and the runoff areas are actually fairly correlated, right? There's a significant overlap for...
There's an overlap in the central area, definitely.
Right. So you're not able to effectively tease out the effects of malaria, infant mortality effects that you're seeing, malaria versus the agricultural effects.
Well, I'm not certain if that's true, because if you look at the coefficients, the high runoff variable here is insignificant for within basin dams. But if you look at the within basin dam effect over here, yeah, that's significant and it's different from 0. So that's telling me that, I mean, it's not just the effect of having a dam in that region, because then they would all be significant, right? So
you would be able to, technically, you would be able to interact it and test for it, right?
Yes.
So, yeah.
But because the coefficients are different, I mean,
Right.
it's just telling me that. And these guys were all insignificant in the other one as well. The upstream dams didn't matter for malaria.
Right.
So it's not a regional thing. I mean, it's fairly convincing to me that it's not a regional thing. So for within basin dams, we're picking up this mechanism through agriculture and through malaria. For upstream dams, neighboring upstream dams reduce infant mortality in the order of about 6.2 to 7%. But upstream dams farther away, on average, are increasing infant mortality about 2.2 to 2.36%. Upstream dams farther away, in fact, actually increase infant mortality of about 7.6% in cropland areas with high river runoff. So this is the floodplain recession agriculture result that I was talking about, which is telling me about the agricultural mechanism. Finally, how many kids are we actually talking about? So if you actually aggregate the results over how the sample is distributed across the continent, you find that about 4,700 kids survive infancy after exposure to a neighboring upstream dam. Exposure is actually responsible for saving 20% of those kids, about 19.1%. It's a very big number. On the other hand, 8,000 kids die during infancy after exposure to a dam in the vicinity or to a dam far away. And these dams are responsible for about 14.15% of those deaths. So again, very, very large numbers. So in terms of policy implications, all the results are pointing to the fact that dams are very, very important. So as a policymaker, because I'm looking at non-migrants, if I'm thinking of building a dam, and I know that there's significant barriers to migration, which in Africa often exist, the impact on infant mortality is something that I really should think about in terms of where I'm putting it up. And just since I have a little bit of extra time, what I want to do in the future with this work is think about how dams actually affect economic growth and how that channel is affecting infant mortality as well. So I was just talking with Randall about this earlier. There's now very, very good data on satellite pictures of nighttime lights across the world produced by NASA on an annual basis. And it tells you almost month to month how nighttime lights are fluctuating, increasing or decreasing globally. And the data has been used as a proxy for economic growth in a very interesting paper by Henderson, Storygard, and Weil in 2009. And the great thing about this kind of pictorial data is that it avoids a lot of the measurement problems you have with GDP in developing countries. So if you look at how light intensity is changing in a region, it tells you a lot about the kind of economic activity that's taking place in that region. And you can measure very, very accurately, possibly more accurately than measuring income, how growth is taking place in a developing country. So I can use this data, which is also GIS data, just overlay it on the maps I have already over time to create a panel over the 2000s. And use the data to investigate whether dams actually exacerbate or dampen the impact of shocks to economic growth and infant mortality, which is just a natural extension to the question. And it potentially adds evidence to the impacts I've already discussed. It would just be an additional channel. And it could be something that takes the research again in a very interesting direction, because obviously economic growth is the reason why a lot of these dams are actually built. So it could tell you very clearly spatially that it actually improves economic growth in a particular region, but somewhere else it actually has a very detrimental effect. So in terms of just thinking about spatial effects, I think this would be a very interesting question.
Abhishek, you did try to explain this, that you were using a difference in difference, so in some sense you're not so worried about the migrant population because you're able to look at them before and after. However, does your data have information on whether or not the mothers were migrant from other regions, or is that something you could? I only ask because there's something very troubling about not having sort of looked at it more carefully.
Sure. That's obviously a very different question in terms of how migrants are affected. Because obviously something that everyone is aware of is that in dams you have this problem that people get displaced.
Right.
Because in this paper I'm only looking at the spatial effects of dams through land and malaria,
right.
That's not something I have to worry about.
Right.
But obviously it needs very, very systematic data collection in terms of following people over time,
right.
and asking them why they're leaving a place or why they're going to another place, and which in this data I just don't have. So all I can identify in this data is how long someone has lived in their current place of residence.
Okay.
So identify non-migrants because they just say I've lived here my whole life, I was born here, I've never lived anywhere else,
right.
Which is why it's so appropriate for this study. But for that study, looking at how migrants are affected, it just requires a whole different kind of data.
Right.
A panel, ideally, which I don't have here. Yeah.
Just following up on that, when they're asked that question, so if somebody moved 3 kilometers away from, they used to live right on the edge of the river, and now they just moved 3 kilometers up, would they respond as I always lived here, or at which point, because there's sort of migration in a very kind of big sense, and then there's, well, I just moved.
I think in the context of the questionnaire, it's more about have you moved out of this community?
Okay.
And
So
they're saying we lived in the same community.
Okay, so you might still be getting people who kind of moved.
Or displaced.
Just a
Were
little bit.
displaced a little bit.
Potentially, but not by a very large margin, I would say.
Do you see, do a lot of people move around the timing of the construction of the dams?
Again, it's really difficult to pinpoint when people move in this data because it's not.
It doesn't ask.
Yeah, it doesn't ask when did you move. It just says how long have you lived here, how long have you been part of the community, that kind of question.
But the people, I guess, so after the dam's built, people say that they moved there. The time that they moved there, you could tell if that matched up with the time the dam was constructed.
So if you just look at it, a lot of people moved into an
Yes,
area.
You don't have the other one.
Yeah, you don't have
I don't have the opposite one,
Right.
so I can look at it, people move into an
Yeah,
area.
yeah.
But again, for this study, if people are in migrants, I don't look at them either. So I'm just looking at.
Oh no, I know. I was
Yeah.
just wondering if it was.
It's possible to look at it, people move into an area, definitely, but not move out, which is probably what is a more interesting question. People actually move out of an area. Yeah.
Were you able to look at the time since the dam was built? So, it sort of points to different mechanisms. If you see a bigger jump in infant mortality within the 5 years after, or malaria should be kind of steady out behavior.
Sure, that's something I haven't done here. It's a very natural extension to look at how long the dam's been there to see if kids have been exposed at the early stage or at a later stage. But it's not something I've done, but that is something that other people have mentioned to me as well. So it's probably something I might do before I send it out to publication, just to see what's going on.
Related to that, you had mentioned that it takes about 5 years to construct a dam.
Yeah.
Right? So if you're looking at, in this case, you're using year-by-year data. So let's say you're looking at year T, when you say the dam was built. Probably for 4 years before that, there was waterlogging and other issues, right? So how do you address that concern here?
Well, that would manifest itself in terms of a regional dynamic trend, right? So if that is biasing the result, then it would show up in the robustness check with, where is it? Yeah, so it would show up here.
But this is after birth. I'm thinking about what.
But if these dams had an impact while they were being constructed,
Yeah.
it would show up here. So in the 4 years previous, while it's being constructed, it would show up here.
Yeah.
And it's not showing up.
Right.
And also with the instrumental variables, I'm not finding anything. So I think that's not an issue in that sense.
But that's peculiar in some sense. If you think about the waterlogging that happens incrementally over time, and there's no reason to believe that the waterlogging in year 4 is systematically different from waterlogging in year 5, or the mosquitoes somehow have changed the way they behave. So something's going on there.
What's possible is that they only did what happened. Essentially, the dam when it's built, there's like gates that open the river or block the river. So when a dam comes into operation, they flick a switch and the dam closes. So it's possible it happens at the last minute.
Okay.
So what I would say is that they build the entire structure, and then there's usually in Africa, especially when the dams were constructed in the 50s all the way up to the 80s, it was a very big deal, and the president would show up and there'd be a really big ceremony,
Right.
and then he would pull the lever or flick the switch, and it would come into operation, which would mean it would start filling up the reservoir.
Yeah.
So I think the fact that it would actually close up in the final year of its construction would mean that there was probably not much waterlogging, or maybe in the previous 6 months, but then it would still be in the same 12-month period if they're incrementally filling up the reservoir. I think that's probably the reason for that.